Nowadays, heart disease is very much familiar to everyone. One of the 100 is suffering from heart disease. Now, I am going to share a short speech on what is congestive heart disease. Congestive heart disease is a commonly misapplied term for the condition called congestive heart failure, that is CHF. When you see the initial CHD, this tend to refer to congenital heart disease or defect. Unlike heart disease that is acquired later in life, congenital heart defects are inherited and present at birth. What makes matter even more confusing in that people with CHD may have congestive heart failure. It is important to understand that congestive heart failure doesn't mean that heart is presently failing. Instead, it means the heart is working harder than it needs to, but still accomplishing less than it should. Failure for the heart to adequate supply the body organ and tissue with oxygen rich blood can result in numerous symptoms, and causes of congestive heart failure can be extremely varied. Some causes include narrowing of arteries, heart attack in the past, hypertension, CHDs, abnormal enlargement of heart, and certain infection. Symptoms of heart failure can be varied and are based on severity of underlying causal factor. People may feel persistent fatigue and notice water retention or swelling of hand and feet. Other symptoms include shortness of breath, inability to exercise, and a cough that doesn't go away, and which may produce pink or slightly bloody mucus. The heartbeat may sound weak or irregular in rhythm. Under some circumstances, congestive heart failure occurs suddenly and is called acute heart failure. These symptoms are similarly, but they occur very quickly instead of over a long time period, and they may accompanied with chest pain. If you develop this symptom in the space of few hours, you should contact emergency service immediately. If doctors suspect congestive heart failure, you will likely have several tests to determine cause. This can include X-ray, magnetic resonance imaging, that is MRI, and computerized topography, that is CT scan, and special sonogram of the heart called echocardiogram. You may also require heart catheterization, which looks at the structure of the heart and arteries to determine blockage, narrowing, or failure. Identifying cause is important since treating CHF depends on understanding and addressing underlying conditions. Due to the vast variety of conditions that can result in congestive heart failure, treatment is difficult to describe. People may require medication like blood pressure meds, blood thinner, meds to make the heart work more efficiently, drugs that help control heart rhythm, or diuretics to reduce fluid retention. Causes may also need surgical treatment, which can again vary from placing stent to open arteries to perform surgery to regulate heart rhythm. Sometimes, especially when CHD are present, surgery may be complex and involve fixing defect of heart like replacing valves. Under certain circumstances, CHF may necessitate a heart transplant. Though you can't do much to preventing many congenital heart defect or CHF acquired through viral or bacterial infection, there may be plenty of way to lower the risk of CHF caused by most famous of forms of cardiovascular disease. Eating a heart healthy diet through life and getting plenty of exercise can reduce the risk of most form of heart disease. If you have family history of heart disease, you need to make your doctor aware of this so that treatment are given as needed and potential for developing CHF is carefully watched. So if you have any past history, do behave properly and eat a healthy habit food. It is very much needed for your prolonged life. That's all for today. Have a great day ahead.